Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Stephanie Desmond. Today, the topic is the CDC and its tarnished reputation following the COVID-19 pandemic. I talked to Steve Morrison, a global health policy expert at the Center for Strategic and International Studies, and Tom Inglesby, who heads the Johns Hopkins Center for Health Security. They discuss a new report that makes recommendations for how to return trust and confidence to the nation's top public health agency. Let's listen. Steve Morrison and Tom Inglesby, thanks so much for joining me.
Thank you. Lovely to be here
with you.
So I want to start with you, Steve. You all are here to talk to us about a recent report that you were both involved in about the CDC. Where would you like to start?
Well, thanks for giving us this chance, Stephanie. It's great to be with you. And it's great to be here with Tom Inglesby, who co-chaired with me this report. This report was done through the Center for Strategic International Studies, CSIS, in Washington. We have a commission on health security. It's a working group within that. And we decided back in the summertime that we wanted to do this on a quick schedule between very end of August, get something out the door, published January, so that it could help inform those in Congress and within the administration about how to get CDC's performance up to a higher level and how to get trust and confidence back in order. The basic premise was that they're at a very difficult point right now. They're in trouble. They're in peril. And we need to look at it seriously because America needs a very good, well-functioning, high-performing public health agency to protect all Americans. And we're not getting that, and it's at risk. And so what we did was put this together. We have 38 people, very diverse, prominent people who gave us a lot of time on this. We put a big focus, not on everything. It was on the pandemic response. We looked at data, budgets. We looked at culture and guidance. We looked at communications. How well does this entity navigate the halls of power? How well does it communicate to the American people? How well does it engage Congress? And is its mission clear or not? And we came up, we wanted to have this be a very, very bipartisan effort. We wanted to make clear to people, this is something where Republicans and Democrats of common sense and good faith come together around a very concrete agenda. We wanted this to lay out very concrete, actionable, and serious steps that could be put in place, and so that people could look at that and go, okay, that's a good idea. We were very fortunate the Washington Post embraced it in its editorial page, bottom to top, in its recommendations. That was very unusual, and we were very happy about that. Why don't I stop there? There's plenty more to say about the conclusions and the complexities of all this, and maybe Tom can walk us through, like, what were the main things that we landed on?
Sure. Yeah, I'd be happy to quickly review some of those. So I think our recommendations broke down into three big categories. The first category was the importance of clarifying both the domestic and international mission and integrating it with the other agencies doing work in the preparedness space. The second was to do what we can, do what CDC can, Congress, the White House can, to increase leadership and accountability at CDC. And the third was to improve the operational capability of CDC through a variety of measures. And so all of the particular recommendations we have fell into those categories. And just focusing on the first one a little bit, and then we can come back to the others, Stephanie, as we have time, is just the importance of kind of making sure that Congress, the public, the other agencies of government, the state and local partners, the private sector really understand what CDC does, what its responsibilities are, and what the other agencies of government do or other entities beyond the federal government are responsible for doing. So, for example, we all know that CDC is the nation's premier public health agency in terms of responding to large outbreaks, providing the best possible scientific guidance, It also is the provider of technical assistance and grant support to states, but it's not the place that is working with companies to make a diagnostic test, for example. That's other parts of government. Or it's not the place doing basic research to understand something, at the molecular level. That's more along the lines of what NIH does. I think we think it's really important to clarify where CDC's role is singular and important and extraordinary, and to make sure CDC is not on the hook for things that it can't control. Mm-hmm. And similarly, there's a lot of importance in understanding what CDC's international mission is, and maybe I'll turn it back to Steve there to talk about that, because he's spent a huge amount of time thinking about the international public health work of CDC and USAID.
I'll allow that, even though I'm supposed to ask the questions.
I'm sorry, Stephanie. All right. If you'll allow it.
Yes, Steve.
Okay. On the global side, the global mission is a terribly important instrument of foreign policy. It's a terribly important interest in advancing global HIV efforts. It's a terribly important one earlier with smallpox eradication. It was terribly important today in building capacity in global health security, but it gets overlooked, and it lacks a career pathway. It lacks secure and flexible money. It doesn't get the respect it deserves. It needs stronger leadership. All of those things. It accounts for about a quarter of the budget when you factor in the HIV, the PEPFAR monies that go through it. And it accounts when you add in all their personnel, the talent they hire around the world. They've got about 1,800 employees. So this is not insignificant. And for the future, we got to play a role as a leader in building capacity for preparedness and response. And so integrate it, acknowledge it, elevate it, give it stronger leadership and the like. One thing I want to mention is that this logic, we've already seen this logic in action. Dr. Walensky announced just 2 weeks ago the appointment of Howard Zucker, former state health commissioner in New York State, to be the new deputy director for CDC responsible for the global mission. This is a brand new position created as a number 2 to the director, but with global responsibility. So very welcome move, terrific person appointed to this, long overdue, a good move. And he's at work now. He's been working now for 2 weeks. So there's some alignment in the logic of what we're arguing and what internally within CDC they've recognized the need for doing this. Thank you.
So Tom, CDC, I understand, used to be extremely highly respected, and there was a lot of trust and confidence in the CDC, and that has plummeted in the last several years. And I was hoping you could talk to me a little bit about why that's the case and how we dig out of this hole.
Yeah, we did definitely track that and see data for that in the course of this study. The public sentiments around CDC have come down substantially over the last couple of years across all groups, and it is really important for us to restore trust in CDC, because it's going to require in future emergencies people having confidence in CDC and the government in order to take actions to try and slow things down or diminish the impact of future crises. And so it's also true, Stephanie, that CDC used to enjoy among the highest favorability ratings of the federal agencies. And I think our view coming out of this report is that there's no real shortcut to getting back, but good, strong capability and the demonstrated capacity to respond to new emergencies and new outbreaks, new crises is what is going to kind of turn things around for CDC. It's also really important for CDC to be on the top of its game in terms of communications. It sometimes hides its successes under a bushel, and they could do better at kind of explaining the new things that are going on there, the new Center for Forecasting and Analytics, the new way it's reporting on information in the middle of outbreaks that we saw during, for example, monkeypox. But there's no real shortcut to restoring public confidence. And the reasons for it, I think they had real troubles with diagnostic testing at the start. And then many of the things that they had to do were controversial. They had to issue guidance around very difficult societal issues, around masks, around vaccines, around schools, which were upsetting for a lot of the country. And kind of thinking about its guidance process and who to include as they develop new guidance and how to share that guidance development process with congressional leaders. All that is part of restoring the trust that the Congress has in CDC and restoring the trust that the American people will have in CDC.
I wanted to pick up on something that Tom just said, Steve, and ask you. You talked about, this is kind of going to have to go through Congress and the White House, and we know that the partisanship feels like it's at an all-time high. It feels very polarized right now. What is possible in this environment?
We have to continue to press forward with common sense, actionable, pragmatic measures that will benefit all Americans and change try and move beyond the anger and the toxicity. There's no question that there's enormous anger and frustration out there being vented against CDC, against FDA, against state and local authorities, in the aftermath of this pandemic. It ignited a reaction, and it was not just in the United States where this happened. And so the sharp drop in trust, public trust and confidence, is a phenomenon we're seeing with public health institutions in the United States, and something we're seeing globally as well. There has to be a strategy of patient, pragmatic engagement. We have to listen to people. We have to talk to people. Some of the gripes that people have are very legitimate. There are calls for greater transparency, greater speed, greater accountability. Those are totally legitimate. There's calls for greater equity. People's dissatisfaction comes from multiple directions. Tom mentioned that these public health decisions had hugely disruptive impacts on people's lives. Employment, income, learning of their children. All of these things came together, and oftentimes they were done in a way that was rather brutal and not well explained, with not a lot of consultation. This wasn't just a clash of science with emotion and politics. This was a pandemic that overran our institutions, in which the decisions made on public health grounds had huge societal impacts. And we're just learning now how to unwind some of the bad consequences of that. And it's not good guys and bad guys. It's got to be a process of engagement and internal introspection and self-criticism. One thing that I think Dr. Walensky deserves a lot of credit for is back in August 11th of last year, she said, I'm going to start this program of internal reform called Moving Forward. And the first thing I want to say is we've made very big mistakes in this period of this pandemic, and we own those mistakes. And we have to acknowledge them and fix them. And let me tell you what the major mistakes are. Owning those mistakes and admitting that to American people is a very, very important first step in doing this. But a lot more has to happen. There has to be improved performance that people see and acknowledge and begin to turn their perceptions that these people are incompetent, that they don't care about what we want to do, that they are they're elitists and they're overly empowered to have influence over our lives. They have to see a different kind of CDC than that. And that requires getting out and talking to people, engaging state and local authorities, winning the confidence and the support of governors who are at the front lines of all of this. Tom and I talked to a number of governors, and it was fascinating to see how much they became engaged in all of this. And they had very mixed feelings about CDC. They didn't start from a feeling of negative and animus against CDC. They were disappointed, and they wanted to see CDC come back. And that was Republicans and Democrats. So I think that we have to bring down the temperature. We have to bring down the toxicity. We have to get over this hump of intense anger. And we have to have an action plan that people of common sense will see. But we have to show some humility and self-criticism as a community.
And so, Tom, I'm going to leave you with the last word, but I'm so glad I'm here to ask you this question, because what keeps me up at night is like what happens when the next pandemic comes, because things didn't go so well this time. So what needs to be done immediately to prepare for the next?
Well, if we're talking about the CDC, I think that's the kind of the frame for this discussion, because a lot needs to be done across the government. But for CDC, I think the reforms that they are making about getting their organization much more adept at operations, I think are really important. They are in the midst of a big change there and really getting everybody trained up to be able to move quickly into the emergency operations realm. That's hiring practices, retention practices, what they train for. That's really important. They're also working, as Steve mentioned already, they're working to get new talent, both in their leadership structure and across CDC. And they're going to need to get better access to data from across the country to be able to do what Congress and the White House and the public expect them to do, which is to be able to provide rapid picture for what's going on every day. That's one of their jobs, is to say, this is how things are going. They're better or they're worse, or this is what we project in a week. And they're just going to need much better data. They're going to need much better budget flexibility. Those are things Congress can do. They need contracting flexibility so they can reach out to the private sector to get things they need in the middle of crisis. These are all things that they're not rocket science, but they can't do it on their own unless they get the help of Congress.
And Steve?
I just want to reinforce this point that Tom is bringing home, which is there are structural barriers within CDC that stop it from being able to be nimble and fast in a crisis situation. And it needs to have access to data. It needs to have budget flexibility. It needs to have operational surge capacity. It needs to have contracting authority with the private sector to deepen it. And those things, we really need to get our arms around those and depoliticize them as much as we can in order to move forward. The last point I make is the power to reset CDC lies outside of CDC. The power to reset CDC lies at the White House, at the Secretary of HHS, and among key Democrat and Republicans in the House and Senate. They need to be sitting down together and mulling over this action plan that we've laid out and deciding how they're going to execute. The power does not rest in the hands of the CDC director. She has certain things she can do, and she's doing many things, and she deserves praise and support for what she's doing. But she cannot fix most of the problems that are there.
Steve Morrison, Tom Inglesby, thanks so much for joining me.
Thank you, Stephanie. It's great to be back together with you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.